Although much has been done to empower the children living with disabilities, yet it is said that more needs to be done to include them into mainstream education along with the other children. So, what can be done to include them? This workshop is said to be one of the steps towards having inclusive education, which means accommodating all children with different abilities together in the same classroom. The workshop Family School Partnership for an Inclusive Classroom was attended by the Early Childhood Care and Development Center teachers, owners, and parents, facilitated by a speech and language therapies from Singapore. As of now, the ECCD centers could not accommodate children living with special needs as they are not equipped with trained professionals and infrastructures.
So far, I don't have any, and actually, I've always wanted to help children like that because I know we have quite a few Bhutanese who do have many different disabilities, but I've always been hesitant, not because I don't think I could have the patience, but because I didn't think I'd be a professional to able to help these children. I don't want to make things worse or not help at all. So, but with this workshop,
Well, so far we have children who have speech delay, or we think who have speech delay, children of concern. We are concerned in that area, and that's all we have for now. Because again, we have to go with what we are capable of doing. We just can't. But we are open to welcoming all kinds of children.
They said such workshop gearing towards inclusive education is an eye-opener for them.
as an ECCD owner and operator, I was very excited to hear there'll be a professional from Singapore coming who's a speech language therapist. So I was excited to see what this workshop would entail. And I was pleasantly surprised with this workshop, but just like I'd hoped, I've learned many ways how to open up my teaching skills with my children. And I've learned many ways to open up my teaching skills, especially what really stands out is the OWL, owling, which is observe, wait, and listen.
With this workshop, we're trying to train the ladies that we have right now. So most of them are class 12 pass out. Some of them are graduates also, but they lack the skill, but they have the interest. So when you have the interest, then you're willing to learn. So we expose them to workshops like these, and we've had other workshops that they've attended also. With children, first of all, you need to have a set of tools. And what this workshop offers us is that set of tools. And of course, the more we are exposed to such workshops, the more we'll be able to help these children.
They said it is time to do more in building inclusive education in the country.
I have learned that we are all working towards inclusion, and it doesn't mean that you have to be a medical professional to help children with disabilities. Through this workshop, I have learned a lot, which I'm so happy. Even for a child with wheelchair needs or cerebral palsy or any of these muscle problems where they can't sit up properly, she has taught us many different things, like we have to help with our environment, change it around to help with the child, and at the same time you make sure they're included in everything you do, so they feel like they're part of the whole group and not segregated in any other way.
So we have to start now. I have a brother who didn't have that when growing up, so I feel like maybe having gone through that and seeing my brother not being able to participate in everyday life like the way we did, I feel like it's even more important, and that is actually what drives me to make our little center inclusive.
While a parent attending the workshop said it made him understand better to help his child overcome the challenges he is facing as of now.
We can see through interaction with our kids that there are some problem, like in my case it's in communication, but after knowing this, we took him to hospital. After knowing this, we consulted other people. But however, I think lack of specialist and lack of, I think, a place where we can get a definite answer that, okay, this is the cause of the problem, or maybe this can lead to that situation. Such kind of things are not there. And when Jen from Singapore came here, I took this opportunity to take part in this workshop or this training, and then it's an eye-opener for a parent like me. I came to know many things about communication and what we can do at home, especially like curriculum modification and adaptation. We can do a lot of changes, and then there are a lot of strategies, and there are a lot of skills that we are introduced to. And I think we should have something like that for all the parents. It's not only for parents with kids who seem to have problem in any of these skills, but I think it's for everyone to know that your child is not with some kind of a problem or lacking some skills.
He said it will be helpful if early childhood care and development centers have trained professionals.
Early intervention and early screening, and then trying to know the problem of the children, it's very important, so that we can improve and we can build on the weaknesses of our children, and then we can work on and make their days in the ECCDs and at home enjoyable. We should have more schools who are fostering or who are gearing to inclusive classroom, and I feel that such kind of workshop is it's important for all the schools and all the ECCD centers to avail and improve and work on the development of children.
The workshop was organized and initiated by the participants themselves, and they feel it will go a long way in helping the children with special needs.
It's been 7 years since we started Hejo, and initially parents were not very eager to be involved in what we do, because the concept of ECCDs is very new to our parents. They kind of think of us as a maybe babysitting center, which is also okay. So it was very hard to get them to be involved. But over the years, I find more and more parents are willing to be involved. And this year, after I attended Jean's September workshop, I shared my experiences with my parents, with the caregivers. We had our PTAs, and I mentioned it to them, and I said, this might help you. Actually, this will help you. This will help anybody and everybody. So I asked them if they were willing to participate. Of course, most of them couldn't make the time. They're very busy parents, but a few did come through. I think most of the parents attending this workshop are from Hejo. And that will help, because now I'm going to ask them, the parents, to come and talk to the other parents who didn't attend this workshop about their experiences, and maybe they'll have a positive influence on our new parents this year.
The speech and language therapist from Singapore talks about what it means to have an inclusive education.
So inclusive education is based on the principles that schools should accept all children. So this means that regardless of their abilities or differences in terms of cultural and linguistic backgrounds, schools should accept all children. Okay, so inclusive education is also about the school being ready to cater to children of all learning abilities. So what we have seen is that we find that some children, if they can't conform to what the school is able to provide, we know that some of them are rejected enrollment in school. But really, schools should be ready to provide and cater to all children.
Okay, now to start with the inclusive education, do we need trained teachers and additional infrastructures from what they are already in place?
Yeah, so definitely. I mean, let's start with the infrastructure. For children with physical disabilities or those that are on the wheelchair, we definitely need, the proper infrastructure for them to get around independently. So things like ramps, railings needs to be in place in the environment for them.
Well, why is it important to have this inclusive education? Why is it necessary?
I think, we would like children to, we want all children to have access to education, and we do not want any child to be excluded from that. Education is a place where children get to learn many, many different skills, and we want all children, regardless of their abilities, to have access, and it is really their right to have, education.
Okay,
Yeah.
then if in case that all the children with like all different abilities not included together, what will be the impact on children living with disabilities?
I think the situation that we know now is that a lot of children, parents are eager to send their children with disabilities to school. What we're finding is that schools, despite how eager they are, and we find that teachers are really passionate and really eager to help these group of children, they find themselves inadequate in terms of training or knowledge to assist them. So that this makes them a little bit apprehensive. When they are, and usually what happens is that they are kept at home when they're really, in fact, ready to learn and just be like all the other children.
Okay, how can this inclusive education really help those children living with disabilities?
So firstly, it gives them a chance to learn. And we know from studies and research is that when they are with the other peers, they actually make lots of gains across the developmental domains because they have a chance to see how the other typically developing peers are interacting or how they're learning. So when they see their peers doing it, it serves as a good model for them to learn. Yeah.
Okay, looking at the current scenario in Bhutan, do you think that this is actually happening?
I think there are a group of children that are being, that are going to school, but we also do know that there is another group of children that, like I mentioned before, they're not being accepted to school because of a variety of reasons. And what happens is that they're just kept at home and they are deprived of a, chance at education.
Okay, why is it important that a child, that the parent or the experts should have like early intervention in the child's life?
I think, we know from studies and lots of research has shown that, early intervention can make drastic changes, to a child's life. I mean, if we know that something, he's having any challenges or difficulties in early years of his life, if he gets the appropriate attention, whether it's medical treatment, therapy intervention, we know that big changes can take place. And if a child might be delayed in the early years, once he has adequate, therapy or intervention, that could change. So he or she could potentially catch up with his peers with the right intervention.
Okay, when you say early intervention, what age is that right age?
Really as early as possible. So, the early childhood years, so I guess, the preschool years, the years where they go to, the ECCD centers, probably about 0 to 6, so as early as possible. So for me personally, I've seen, in terms of speech and language development, I've seen kids as young as about 14, 15 months. Yeah, once we identify that something, he's having a certain difficulty, we want to do something right away.
Okay, in Bhutan, do you think there is early intervention happening from the parents' side as well as from maybe the stakeholders' side taking up any initiatives?
I think in terms of that, what we really have to start with is that in terms of what we're trying to achieve from the workshop, we're trying to educate and teach parents and caregivers and the ECCD facilitators, firstly, how to identify a delay. When we talk about the moderate and severe disabilities, it's sometimes easier to identify because, if they're having a physical disability, you can see it right away. But for children, they're a little bit mild to moderate. Sometimes it's quite hard for, even the parent to know or the facilitators if they are not exposed to this group of children. So first, we need to identify the children. So what we have done in the workshop is to introduce a screening tool that's really useful to parents and facilitators. It's called the Ages and Stages, so it's used worldwide. And this allows parents to know if the child is on schedule in the various developmental domains, or maybe, the child is maybe running at risk of being slightly delayed. So first we need to identify that before we can start any intervention. So to answer your question, I think in Bhutan, we need to first start to identify, be able to identify those children, particularly the ones, that are mild to moderate, before we can start intervention.
Okay, since you facilitated the
Yeah.
workshop, like how forward were the ECC centers, the owners or the caregivers when it comes to giving like education to all the children with different abilities? Were they forward?
I think it's similar to, what we see in various countries as well. The teachers are really passionate about wanting to include these children. Some of them already have, children with either speech delay or some form of developmental delay in their center, but they often feel inadequate and unskilled to help these children. They are eager, but and they are really eager to learn it. And I guess that's why they came forth for the workshop, to learn more about how to help these group of children.
Okay,
Yeah.
now since you're a speech and language therapist, like when it in Bhutan, like do you think that the parents and I think first one is the parents, like are they communicating enough with their children? Do you think it's happened?
I think in terms of, culturally, like Asians compared to the other Western countries, we don't talk as much to our children. And we, during the workshop, we talked about having a conversation and having an interaction. And when I introduced that concept, it seemed to be quite something new to them. But it's really about telling them a different way of interacting with their children. And we know that it is through an enjoyable interaction. So a two-way, that children give us lots of language, and that gives us lots of opportunities for them to further develop their language.
Okay, so
Yeah.
how important is it for the parents to communicate with their children and to find out all those early symptoms? If you could talk a little bit about it.
I think it is extremely important, like we talked about early intervention. So we want parents to be, vigilant and really take on board their child's development. So we talked a lot about, trying to keep track about their development, looking at the developmental milestones, at any point that you find that you might be concerned, or sometimes, parents have this really strong gut feeling and instinct, but they just can't really pinpoint what is wrong. I really suggest that they speak to a professional because, like I said, once we identify that there is a delay, and when we do that as early as possible, we can give the right intervention and prevent any further delays as they grow older.
Okay, can you contribute social stigma as one of the reasons for the parents to have like a delay in interventions?
I think, parents sometimes need a little bit of time to come to terms that their child is having a delay. So that is quite common, across the various countries that I've worked in. Well, I think, it is a usual process and a typical process that parents go through. I still strongly believe and hope that they come forth as early as possible, because the longer they take, the more precious time we lose that we could use to help the child.
Well, one thing is really nice that you came here as a volunteer to help all those teachers and parents. But then the other thing is that don't you think that not just those private and the small group that you actually focused on, there should be a wide range of schools and all included. So did you ever get the chance to like interact with the officials here?
During the September workshop, which I conducted, we had MOE facilitators, and we had a chance to interact with them at that time. So because it's based on a volunteer basis, and we really don't have any funding, sometimes it's quite hard to reach out to a bigger group of people. But what we're trying to do now is just to start a small step. And I included an outreach component in the program as well. So I'm hoping that all the participants who had a chance to join in this time, they would do their part to tell their friends about, the screening tool or, workshops that are available.
Okay, which means like it's very important to have trained professionals dealing with children at a very early age, right?
Yes, definitely. Like I said, the teachers and facilitators, they're all really, really eager. And I think they are a little bit apprehensive because we always feel that we're not doing enough. And when they don't have experience with children with, additional needs or disabilities, sometimes they get a little bit scared and they think they don't know how to provide best for this child. And I think that's what's holding people back.
Okay.
Yeah.
So if you could share some of your plans now, henceforth, do you have any plans to carry on this forward?
We just ended this workshop on Tuesday, but from the feedback, parents and the facilitators, they really, from what I know, they felt that they really learned a lot, and they thought that, their friends, other friends, and their other facilitator friends as well would benefit from this too. So we are, looking at maybe either continuing this or, reaching out to other groups of people.
Okay,
Yeah.
you have been here for quite a while now, last year as well.
Yeah.
So what were the common forms of disabilities that you frequently saw?
I have been, working collaboratively with Ability Bhutan Society. So they work with children with moderate to severe needs. So I have seen children with, cerebral palsy, Down syndrome, global developmental delay. So I have seen a range. I have seen children with speech delay as well. So a really big range that I've seen. Yeah.
Okay, now last thing, what do you recommend now? What do you recommend maybe the government to take forward? What do you think that they should do more to help those children who are actually living with disabilities?
Like I mentioned, I think firstly we need to be able to, identify a whole range of children, whether it's mild, moderate, or severe. So I think the training really helps, and bringing, parents, caregivers and facilitators together, like in the workshop. I thought that was a really good platform for them to learn from each other and to hear each other's views. I really think it is about the training that's holding facilitators back from, including children with disabilities in their program. So we had a really nice success story in September. This facilitator, she was from Bhutan. She joined, so after attending the workshop, she went back and then she wrote back to me and she said after that she felt more confident, and now she's taken in a child with visual impairment in her center. So I really feel that with the right skills we can start to make a change.
Okay, so what's the last message that you want to pass on?
I think due to the current limited resources, I think parents in particular need to be they need to be very they need to take charge of their child's developmental milestones. So that screening tool actually helps them in that way. So once they think that they sense that there might be some delay, they should really take action right away. And to do something as early as possible.
Okay,
Yeah.
Thank you so much. Well, that was Jean Ho from Singapore, speech and language therapist, and I hope this will help a lot of parents, caregivers, and as well as the proprietors, and not to forget our government. Thank you so much for watching.